Hello, everyone. My name is Arash Asher. I am the Director of Cancer Rehabilitation and Survivorship at Cedars Sinai, and this is a program within the Patient and Family Support Program at Cedars Sinai Cancer. And I'm delighted to welcome you and begin a new chapter with what we're calling the Asher series, Survivorship and Beyond. So cancer-related cognitive impairment, commonly known as chemo brain or chemo frog, is very common in the survivorship setting. Studies estimate that maybe 60 to 80% of our patients experience some of these symptoms when they're in active treatment with surgery, chemo, radiation, etc. But for some, and this may be anywhere from about 20 to 30 or maybe 40% of patients continue to struggle with these symptoms months or sometimes years after the treatment has ended. The most common symptoms I hear may include things such as trouble with multitasking, with executive function, word finding. That's a common one that can be quite distressing to some, where there's a word on the tip of your tongue and you just can't get that word out. Problems with short-term memory or also even just processing speed. It just feels like it takes longer to get some cognitive tasks done. So when some of my patients come into our clinic and are scared about these symptoms, invariably some ask me if this is dementia or if it's going to lead to something like Alzheimer's. And I think it's important to anticipate that because there's no evidence that cancer-related cognitive impairment is linked in any way to dementia. So I outright say that, but still people often are looking for some way of conceptualizing what is happening to them. And the best analogy I've used is really comparing it to the flu. And for example, I will tell them or ask them, how do you feel the last time you had influenza or let's say a bad case of COVID? And invariably people say, I feel, crummy and exhausted and just maybe a little sad or blue. And you'll ask them, well, do you want to take a textbook and study for a midterm in the middle of a flu? And of course, the answer is no, because they feel foggy and a little bit just cloudy in their thinking. And we know, and I share with them, that it's not generally the flu virus that makes you feel cloudy and exhausted and maybe a sad, a little blue, but it's your immune system response to the flu, right? With that, our inflammatory response to the foreign virus that produces these constellation of symptoms. And I relate that it's possible, and we believe that our immune system is responding to the chemotherapy or radiation or some of these other insults in an analogous way. And I think that framework helps them understand and relate to these symptoms in a way that they already know, because everyone's had the flu before and they know how it feels to kind of feel down that way. So nobody, in my opinion, knows exactly the mechanism driving cancer-related cognitive impairment. And like most things in human biology, it's probably multifactorial and complex and may vary based on each patient's circumstances. But some of the common themes that are described over and over again are related to inflammation. Again, inflammation related to the cancer itself or its treatment. And this inflammatory process may be compounded by psychological distress or even other medical comorbidities that the patient may have. The other kind of prevailing theory has to do with oxidative distress and mitochondrial dysfunction. Some are arguing that mitochondrial dysfunction, which may lead to decreased ATP in the neurons, and also relating to inflammation via these pathways, is an important mechanistic driver. But I think it's important to realize that there are other drivers. We know that, for example, just insomnia, which is incredibly common in this setting, may contribute to cancer-related cognitive impairment, that deconditioning and loss of muscle mass, other medical comorbidities, possibly nutritional factors, all these things may contribute depending on each person's circumstances. So our team, including my neuropsychology colleagues, created a program called Emerging From the Haze, which was intended really to kind of bring together a number of strategies to help patients cope and navigate and rehabilitate from this cancer-related cognitive impairment phenomenon. At the time, to be perfectly honest, our only goal was to help, 8 patients that we had in our clinic at a time, because there was nothing really to point to in terms of helping patients who are struggling with these symptoms. Again, this was about 10 or 15 years ago when there was relatively a dearth of information on how to help support these patients. So we were just trying to take care of some of our patients internally. Over time, as we ended up studying and formalizing and structuring our program, we're really been keen and interested in scalability and offering it to others around the country who may not have this kind of structured cognitive rehabilitation program available at their centers. So it's interesting because there often is very inconsistent at best correlation between perceived cognitive symptoms and objective neurocognitive testing. And I think the reasons for this are kind of complex. One theory is that when you have the subtle type of symptoms that are described within cancer-related cognitive impairment, and you put that person through objective neuropsych testing, when they're sitting at their desk doing these tests with no distractions, none of the real-world responsibilities related to multitasking and whatnot, it ends up often being a relatively clean report. Whereas when you're in the real world, going through day by day with all the challenges and stressors and cognitive challenges that are before us, the perception that I'm just not operating as well as I used to seems to be real. So I personally and our team believes that the symptom, the perceived cognitive burden is as important as anything else. That said, one of the reasons I believe that the Emerging From the Haze program has consistently shown an improvement in perceived cognitive functioning is because of the agency that we teach our patients. So one of the goals with the program is to teach our patients what they can do, right? The things that they still have in their control. We talk about the idea that, the chemo, the radiation, the surgery, that's past, and there's not anything we can do about that. But we can focus on optimizing our exercise regimens and our nutrition and cognitive and behavioral strategies for anxiety and depression and sleep. There are memory strategies, attention strategies, word finding strategies that we know we can practice that can improve our cognitive performance. We talk about neuroplasticity and the promise it may have to improve cognitive pathways. So I think because we put the focus on what we still can impact, we improve agency, and I think that's what improves perceived cognitive performance. So we recently published a study comparing our Emerging From the Haze program done live with myself and my neuropsychology colleague, Dr. Jeffrey Wertheimer, delivering the information in a group setting virtually, compared to having a clinician in another center offering the program in a pre-recorded fashion. So the content and information is delivered in a consistent way in a virtual setting, but the group was kind of supervised with somebody that didn't involve myself or my colleagues. And the reason, obviously, we wanted to do that study was we wanted to show that it had nothing to do, the benefits of the program had nothing to do with me or my colleagues, but that anybody who is somewhat knowledgeable in terms of running a group program can manage a group and share the information that's pre-recorded in a consistent way. And our hope is then that we can make this more scalable, share this with other cancer programs, and maybe eventually even offer it directly to patients who may be unaffiliated and are looking for cognitive rehabilitation options. Our group actually published an entire study looking at the correlation between the symptoms of loneliness and the symptoms of cancer-related cognitive impairment. And the correlation was quite striking. And I remember that one of the reasons we want to explore this is because I was aware that in the general population, chronic loneliness is associated with cognitive impairment, faster decline in executive functioning, more negativity, and more symptoms of depression. And I think we were the first group that established this correlation in the cancer survivorship population. One of the reasons I think that the Emerging from the Haze program has been successful in subjectively improving cognitive symptoms and also improving loneliness is because we actually spend a fair amount of time validating the experience of chemo brain. So when you're in a group of 8, 12, 15 patients, and everyone hears about each other's experience that, they've had some word-finding difficulties, multitasking challenges, a harder time getting back to their work in law or medicine or whatever it may be, right? You feel less alone. It can be a really isolating experience to go through some of these cognitive challenges, especially if you feel like you may be one of the only ones going through it. So photobiomodulation is a technology that I think has garnered much more attention over the last decade. There's high-level evidence, for example, and its use for preventing or treating oral mucositis in the cancer setting, and exploratory ideas for using it for chemo-induced neuropathy and lymphedema and whatnot. There were small studies of applying photobiomodulation via helmet or similar devices for patients who have undergone strokes, traumatic brain injury, or in the general adult population having cognitive impairment. So when I learned that, I became quite interested in exploring whether this might be of value for patients experiencing cancer-related cognitive impairment. And so we designed and are about to launch, I believe, the first study looking at photobiomodulation and how it may impact both subjective and objective symptoms of cancer-related cognitive impairment among cancer survivors. So since we designed this photobiomodulation helmet study as a pilot, and it is a randomized clinical trial, so there will be an authentic light condition and an artificial light condition as a placebo. The first thing we're looking at is whether this is viable. So can we demonstrate that our patients will come 3 times a week for 6 weeks, complete the assessments at baseline and post to look at the viability of this kind of intervention. But again, we're also looking at validated tools for subjective cognitive impairment and objective cognitive testing. And if we can show that there's an improvement in cognitive performance compared to the placebo group, it would be really exciting because, again, this can be a scalable intervention where, right, the light helmets are reasonably affordable and it can be offered throughout cancer centers around the country, and it would be, we believe, a very safe and we'll see if it's effective intervention for patients with chemo brain symptoms. So photobiomodulation therapy is using a spectrum of light that we believe is therapeutic for reducing inflammation, for improving mitochondrial function, and quite possibly contributing with neurogenesis. I don't think anyone knows exactly which of these mechanisms or others may be at play for its use in brain function and cognitive functioning, but those are the most common mechanisms that are described. So chemo brain or cancer-related cognitive impairment can be quite distressing to many of our patients. And if I can share just 2 or 3 concrete steps that every patient can take that we believe can meaningfully improve their cognitive symptoms, it will be the following. So number 1 is the value of time, right? There's a number of studies that show that just giving 6 to 12 months after the acute phase of treatment with the surgery, chemo, and radiation has passed, many patients will go back to their baseline. Practical tip number 2, everyone should be exercising at least 150 minutes of moderate aerobic exercise per week. We already know it's helpful for cancer-related fatigue and that it probably reduces recurrence rates for a number of cancer types, but there's emerging evidence that it may also help with cancer-related cognitive impairment. Number 3, even though they're not the same, there's a lot of overlap between the symptoms of chemo brain and the symptoms of depression and anxiety or loneliness. So if we recognize some of those symptoms related to depression or anxiety, it's important to get those treated, whether it's through medication, psychotherapy, or other integrative strategies. It can make a big difference in how we are doing from a cognitive perspective. And the last one I'll just share is, again, there's a lot of overlap between the symptoms of insomnia. The correlation between insomnia and the degree of insomnia and the degree of perceived cognitive symptoms is quite high. And so treating the insomnia, ideally, if possible, through non-pharmacologic mechanisms or interventions with, for example, CBT for insomnia, I think can be quite helpful. So for all the clinicians out there, if you have access within your centers to cognitive rehab, whether it's through speech therapy or neuropsychology, or through group programs such as what we have developed here at Cedars Sinai, I would encourage you to at least offer it to your patients, because while not every patient has these chemo symptoms at the top of their priority list, they may be have other battles that they're interested in battling. For a meaningful subset, this is among the most distressing of symptoms. And I think if we can identify them and then refer them to our colleagues that can offer interventions, I think we could improve their quality of life quite significantly. Thank you, everyone, for joining. Today, we discussed the symptom of chemo brain, also known as cancer-related cognitive impairment among cancer survivors. We talked about the idea that it's quite common among many cohorts of our cancer survivors, and that there are emerging strategies that we can employ to help our patients, including cognitive rehab programs, CBT, insomnia for optimizing sleep, improving exercise and activity for its impact on neurogenesis. And we're exploring new strategies such as photobiomodulation to potentially mitigate this really common concern. I look forward to seeing you for the next Asher series, Emerging Topics in Survivorship.
Don't forget to like, comment, share, and subscribe to Onco Daily on YouTube. Hit the bell icon to stay updated.